Member North Vancouver Seymour.
Thank you, Mr. Speaker. The North Shore has been devastatingly hard hit from the beginning of the COVID-19 outbreak in Canada. Care homes in my community were not only some of the first impacted, but the first COVID-19 death in Canada was also sadly at the Lynn Valley Care Home. Today I would like to dedicate my 2-minute statement to all those who've lost their lives to COVID. My thoughts are with their families. It was heartbreaking to hear day after day Dr. Bonnie Henry's daily updates that our community was facing such a challenge in fighting COVID. I'm deeply saddened by the deaths, and my thoughts remain with the loved ones and care aides who looked after those elderly patients. I received many emails and calls from frantic loved ones who were worried that the care of their elderly relative was not being adequately addressed. Communication between the family members and the facilities had broken down, and not enough staff. And in some instances, at the beginning of the pandemic, some staff not showing up because they feared for their own health. I thank the brave staff who continued to care for these residents during the height of the pandemic, even though they were worried about their own health. They too are our healthcare heroes. Thankfully, the outbreaks are now over, but family members were still prevented from seeing their loved ones until very recently. Some died without them by their side. Our party has requested an independent review to better inform regulators on the physical, medical, and staffing requirements that were lacking and likely contributed to the transmission of the virus throughout these homes. A complete review of the funding model for seniors' care is needed, which also must include home care as well as residential and medical care. It is evident we need a better human resources strategy to meet the growing needs for seniors' care, and for sure we need structural changes because 4 people sharing a room and a bathroom clearly speeds up transmission. If there is a silver lining in this crisis, Mr. Speaker, it is that finally the needs and the care of our seniors will be given the attention they deserve moving forward, to not only prevent another crisis, but to improve the lives and care of our most valuable and vulnerable citizens. Thank you.